Gestational diabetes can cause problems for you and your baby during pregnancy and after birth. But the risks can be reduced if the condition is detected early and well managed. Before we hop in, we'd love you to give us a like. And make sure to subscribe to Statera to keep up with all our latest content. Plus, later in this video, we'll reveal a free gift you can grab today right now, though it's time to discover what is gestational diabetes and how to control it. Gestational diabetes is high blood sugar that develops during pregnancy and usually disappears after giving birth. It can happen at any stage of pregnancy, but is more common in the second or third trimester. It happens when your body cannot produce enough insulin to meet your extra needs in pregnancy. So what are the warning signs of gestational diabetes? Gestational diabetes does not usually cause any symptoms. Most cases are only discovered when your blood sugar levels are tested during screening for gestational diabetes. Some women may develop symptoms if their blood sugar levels get too high, such as increased thirst, needing to pee more often than usual, a dry mouth, tiredness. But some of these symptoms are common during pregnancy and are not necessarily a sign of gestational diabetes. Speak to your midwife or doctor if you're worried about any symptoms you're experiencing. If possible, seek healthcare early, when you first think about trying to get pregnant, so your healthcare provider can check your risk of gestational diabetes along with your overall wellness. Once you're pregnant, your healthcare provider will check you for gestational diabetes as part of your prenatal care. If you develop gestational diabetes, you may need checkups more often. These are most likely to occur during the last 3 months of pregnancy, when your healthcare provider will monitor your blood sugar level and your baby's health. Some of you may wonder about the risk factors for gestational diabetes, which are summarized as follows: being overweight or obese, not being physically active, having prediabetes, having had gestational diabetes during a previous pregnancy, having polycystic ovary syndrome, having an immediate family member with diabetes, having previously delivered a baby weighing more than 9 pounds, being of a certain race or ethnicity, such as Black, Hispanic, American Indian and Asian American. And if you have gestational diabetes, your baby may be at increased risk of excessive birth weight. If your blood sugar level is higher than the standard range, it can cause your baby to grow too large. Very large babies, those who weigh 9 pounds or more, are more likely to become wedged in the birth canal, have birth injuries or need a C-section birth. Early birth. High blood sugar may increase the risk of early labor and delivery before the due date. Or early delivery may be recommended because the baby is large. Serious breathing difficulties. Babies born early may experience respiratory distress syndrome, a condition that makes breathing difficult. Low blood sugar. Sometimes babies have low blood sugar shortly after birth. Severe episodes of hypoglycemia may cause seizures in the baby. Prompt feedings and sometimes an intravenous glucose solution can return the baby's blood sugar level to normal. Obesity and type 2 diabetes later in life. Babies have a higher risk of developing obesity and type 2 diabetes later in life. Stillbirth. Untreated gestational diabetes can result in a baby's death either before or shortly after birth. Gestational diabetes may also increase your risk of high blood pressure and preeclampsia. Gestational diabetes raises your risk of high blood pressure, as well as preeclampsia, a serious complication of pregnancy that causes high blood pressure and other symptoms that can threaten both your life and your baby's life. Having a surgical delivery. You're more likely to have a C-section if you have gestational diabetes. Future diabetes. If you have gestational diabetes, you're more likely to get it again during a future pregnancy. You also have a higher risk of developing type 2 diabetes as you get older. There are no guarantees when it comes to preventing gestational diabetes, but the more healthy habits you can adopt before pregnancy, the better. If you've had gestational diabetes, these healthy choices may also reduce your risk of having it again in future pregnancies or developing type 2 diabetes in the future. Eat healthy foods. Choose foods high in fiber and low in fat and calories. Focus on fruits, vegetables and whole grains. Strive for variety to help you achieve your goals without compromising taste or nutrition. Watch portion sizes. Keep active. Exercising before and during pregnancy can help protect you from developing gestational diabetes. Aim for 30 minutes of moderate activity on most days of the week. Take a brisk daily walk. Ride your bike. swim laps, short bursts of activity, such as parking further away from the store when you run errands or taking a short walk break, all add up. Start pregnancy at a healthy weight. If you're planning to get pregnant, losing extra weight beforehand may help you have a healthier pregnancy. Focus on making lasting changes to your eating habits that can help you through pregnancy, such as eating more vegetables and fruits. Don't gain more weight than recommended. Gaining some weight during pregnancy is typical and healthy. But gaining too much weight too quickly can increase your risk of gestational diabetes. Ask your healthcare provider what a reasonable amount of weight gain is for you. Finally, if you have any specific questions or concerns, don't be shy to comment below the video. Also, don't forget to like this video and subscribe to Statera, your hub for diabetes fighting knowledge. And before we forget, you've got a free gift waiting just for you. Discover more diabetes-fighting foods in this book, The Complete Diabetes Cookbook. This book contains 400 recipes specially designed for diabetics. To grab the gift, simply click the link in the description below. Thanks for watching. We hope you have a happy and healthy day.